I have Dr. Silber here and Jennifer Shipp, and they're going to discuss the amazing journey that Jennifer has undergone along with Dr. Silber. So, Dr. Silber, why don't you give us a little intro as to the Jennifer's her whole experience?
Well, I'm here with Jennifer, who was one of our most exciting, interesting patients. Her name was O'Brien then. She was 23 years old. This was 21 years ago when she was told she had leukemia and was really in severe danger of death. And just before her bone marrow transplant, we took out an ovary and froze it. Now, what did we tell you, Jennifer? This was 20 years ago. What
it was.
What did we tell you?
That in regards to the procedure?
Yeah, did we think there was a good chance what do we think?
You were very, very optimistic.
Oh, really?
Yeah, you were. You were.
Okay,
yeah.
And
because I remember walking out of our first meeting just so elated, thinking that I was able to preserve my fertility because I knew I always wanted a family. So you had explained the process, saying that you would remove the ovary.
Right.
You would slice into millimeter slivers and freeze that in liquid nitrogen. And the reason for that is everything would freeze at the same time. So when you had described freezing of eggs, the outside froze first, and then all the way to the inside. That's why you were describing this process was so much better.
Yeah. Well, see, all the eggs are located in the outer little tiny 1 millimeter of the ovary. There's nothing really on the inside. Mm-hmm. So if we just were to, so to speak, slice off the outer rim of the ovary, that's where all the eggs are, nothing important on the inside. And then it allows us to freeze because we can get a rapid temperature drop. So, but this was in 1997. I remember it slightly differently. I remember being very cautious, saying, this is the only thing we can do. We don't know. I remember it slightly differently. Hello? Oh, you're going to have to turn that off, whatever that is, because no one can hear us. Okay, I apologize for that. There was some background noise there. But I remember being very concerned because we could either transplant your ovary back, and the theoretical risk would be we transplant leukemia cells, or maybe we could culture those eggs, but those eggs would take 4 months to develop, and no one really knew if we'd be able to culture those eggs. So those are the two approaches, both of which were problematic. So then we discovered, after years of research, over 17 years later, that as long as we did the ovary freeze when we did, and Dr. Pincus told us this actually 20 years ago, this is the right time to freeze the ovary, because if it's in remission and she's about to undergo a bone marrow transplant, you will have killed all the leukemic cells, and so you're not going to transfer leukemia cells back. Subsequently, that's been proven to be the case, but he said that 20 years ago. And but the eggs will survive, So, anyway, I honestly, I was. Dr. Pincus was more optimistic than me, but there was nothing else I thought we could do.
Right.
That's what I recall, at least. Yeah.
Well, you sold it very well.
Yeah. Right. Well, what else were we going to do? I mean, you wanted to have a family. You'd be sterile for sure, and this was the only thing we could do. And okay, we kept on doing research. I'm always optimistic, and I was hoping we could figure this out. But it was really a long time ago.
It was. Although sometimes it feels like yesterday.
Does
Sometimes.
Well, every year you get older, it goes faster because it's a smaller percentage of your life.
Yeah.
When you were 5 years old, 1 year was 20% of your life, but now when we're over 40, 1 year is a tiny fraction of your life, so it seems really quick. But this is amazing, really. So Jennifer has it was a 24-year-old ovary, but actually now it's a 27-year-old ovary. But here she is, 44. And she's pregnant with her 27-year-old ovary. So, if you had not had cancer, and you really didn't get married or think about having kids until you were 40 or so, you'd have been infertile anyway.
Well, it's true.
And it would have been a real good idea to have your frozen ovary from when you were 24.
Right.
That's the irony of it. You know. So then tell us a little what happened then when we transplanted the ovary back.
We did that October of 2013. I was getting married December of 2013. And that was successful. It took about 2 weeks for recovery just to not strain or do any real heavy lifting, which we were safe for that.
You weren't about to.
Right, exactly. And then you had said that it would probably take about 4 to 5 months for regular menses to start, which it did. It was started in March of 2014. So that's started off very well. And then with the ovary, it wasn't as regular as what I had hoped, which I think is what prolonged us getting.
Yeah, well, you tend to have irregular cycles. You cycle and you have normal hormones, but irregular cycles after an ovary transplant. We've discovered that.
Yeah. It was a little sporadic.
Yeah, but I remember I recommended you to keep having relations and intercourse, and just keep trying because these ovaries last a long time, and it's a young ovary.
It is a young ovary, which is kind of scary.
Well,
70-year-old gives birth. No, just kidding.
70-year-old gives birth. Let's show this. You were the front page of the St. Louis Post-Dispatch in 1997. Can you see that?
Yeah, absolutely incredible.
She was on the front page of the St. Louis Post-Dispatch. It was a real major story. And it was our research effort. She was the first patient we ever did, 1997, a long time ago, to try to preserve fertility in a cancer patient. And all we knew is it worked well in sheep. And this is all we could do. But look at this young kid. I mean, you know, and she was facing death, but typical of your age, you weren't afraid of that. You knew you were going to survive, if I'm right.
Yeah.
Yeah. I mean,
well,
that's classic young thinking.
I just, kept thinking I wasn't going to go out like that.
Yeah, right.
So.
But what really scared her was, being sterilized, you know. And so you went into menopause after your bone marrow transplant.
Yes. May have even been prior.
Even from the chemo, right?
From the chemo, yes.
That's it, because she was on chemo first.
Yes.
And the chemo will destroy the developing eggs, but it won't destroy the resting eggs. So it'd be impossible, hopeless to try to freeze her eggs like with an IVF type approach, because you wouldn't get any response. Those developing eggs aren't there. It's so stupid. People talk about freezing eggs for cancer patients to preserve their fertility. And that's not considered experimental by ASRM, but it's stupid because not only is that experimental, but it doesn't work. Because if they're going to have been on chemotherapy first before they're going to undergo a bone marrow transplant, and that will really kill off the developing eggs. So you were on chemo even before the...
yeah, I did chemo 7 days a week. So I had a very high dose chemotherapy all up until the bone marrow transplant, the first one.
So you had menopause right away, and then we took out the ovary and froze it, and you had a rough go of it. You had a remission.
I did. So we had the first transplant September of '97, and was in remission. But then my cells started coming back instead of. It's what they called a mixed chimera.
You had a mixed chimera. Okay.
My donor cells were so closely matched to my cells that some of my cells survived.
Mm-hmm.
But my donor cells...
You mean bone marrow cells, you mean?
Yes.
Yeah,
yeah.
right. Mm-hmm.
But my donor cells didn't recognize mine as foreign, so mine were able to come back and kill off the donor cells, leading me into a relapse and doing it all over again. So my second transplant was June of '99.
See?
And knock wood, we're good now.
Wow, it's fantastic. 2 bone marrow transplants, and you really you really fought off death, and now Dr. Pincus tells me you're really totally cured.
Yeah.
And that's exciting. And it's 20 years later.
20 years later.
And we were both kids then.
Yeah. We were.
Well, this is really amazing because, talking about preserving fertility, at 24 your eggs are fantastic. And by the time you're 40, when I guess when you're engaged, during the time we were 40, and thinking about having children, you would have probably been infertile anyway, just from the aging of the eggs. I mean, young women are all worried about their biological clock. But luckily, I'm a little bit, this is dark humor. Luckily, you got cancer, and so. Otherwise you wouldn't have frozen your ovary, and then you wouldn't have a young ovary, and then you wouldn't be pregnant now.
That's true.
So
I might have been married and had 7 by now, but that's okay.
All right. Okay.
I digress.
I get it. I get it. But I deserve that because of my dark humor. But it's so exciting to be here with you now after this long journey we've taken together. So, how did you find out you were pregnant?
I just was extremely tired. I teach high school, and I was more tired than normal. And it was just one of those things.
And you didn't expect your...
No. Oh, my...
Because it had been 3 years.
No.
Yeah, okay.
And I thought, well, maybe. Let's see. And I took a pregnancy test. And I just remember looking at it going, what is that? Because I've never had those signs before. And I remember even shaking it like, is this right? And so that was May 18th, that night, that Thursday evening. And I took another one that Friday morning, from a different box just to make sure that it wasn't defective.
Yeah, right. Yeah. Couldn't believe it.
But my husband and I were just elated. I told him that I wasn't going to, and I'm like, I have to tell him.
Yeah. Wow.
So, it was very, very exciting. And then from there...
You might have given up hope after all that time, but...
I was starting to. I mean, I always was hopeful, but I think I was starting to set more into the thought process of this may not happen naturally for us. We had always talked about adoption no matter what, but he was always so optimistic, so hopeful. He was never ever down, and it was very much.
That helps.
Yeah.
So then you have your ultrasounds here.
Yes.
You want to show them? This is your latest one.
That's the latest one.
Show your
This is the first one.
Yeah. And
there's not much there.
Yeah, well, you see a sac there, and there's a secondary yolk sac in it.
Okay.
Okay.
And then this is where the little white dot is supposed to be the baby.
There's
Looks
the
a lot
baby.
like my husband.
And then
this was from yesterday, so it's 8 weeks, 1 day. So they say everything looks great.
Yeah, so we got a good heartbeat, a good developing
Heartbeat
baby.
was 167 beats per minute.
That's pretty damn good.
Woohoo!
Wow. that's really great. This is an example of how doing research when you're not sure how it's going to turn out eventually comes to fruition 20 years later. And that's just good. Now, we knew earlier that we knew in the sheep it would work before we did your freeze. But we found out in the human that would work with our first fresh transplant in 2004 that was in the New England Journal of Medicine. And then we did subsequently like 9 transplants between identical twins, and they all worked.
Right.
And it was just really remarkably robust. So we knew the transplant would work. But nobody still has been able to successfully culture these primordial follicles. They still can't. And there's a reason why. Because these primordial follicles are locked so that they don't just all go through what we call meiosis and disappear right away. And normally one would release 1,000 of these every month. Otherwise, her 200,000 eggs will all be gone before she's even born. So it's natural that you just can't culture in this tissue ovarian resting follicles, just can't culture them for those 4 months. It's not been successful. So what we were waiting for was to get verification of Dr. Pincus's view that it would be safe to transplant the tissue back. So we waited, whatever it was, 17 years, I guess, before we accepted that, because there was data coming out showing that he was right. And so, and now we have 3 leukemia patients that have had transplants back with no recurrence of cancer. And of course, we've had many other cancers that we originally were worried about, but no longer. Well, it's Hodgkin's disease or synovial sarcoma or all kinds of other cancer patients, and they're all getting pregnant. But leukemia was considered the big obstacle, and you were proof. And we have 2 other babies from leukemia, and that are healthy. And yeah, we have questions?
Yeah, absolutely. Dr. Silber and Jennifer, we have some questions coming in about the initial diagnosis, the time between the initial diagnosis and treatment, and how you decided to come to Dr. Silber and go through this path.
I was diagnosed with acute lymphocytic leukemia December 27th of 1996, and I was put in ICU immediately upon diagnosis. It was a Friday, and they didn't think I was going to live through the weekend. I was so far advanced in the leukemia. Started chemotherapy, had apheresis. I was in remission within 24 days, which they were astounded. The doctors couldn't believe that. And so my initial diagnosis was December 27th, and I found Dr. Silber through my transplant doctor. Right when I was diagnosed, the first thing I kept saying was, am I going to be able to have children? Which typically I don't think is what people think. But the oncologist at the time had said, you're going to go through treatments that are probably going to leave you infertile. And so I just started this plight of what can we do? What is out there? And the only thing that was coming up at the time was fertilized eggs, freezing of fertilized eggs. And the person I was with at the time was not an option to have that done, thankfully. So it was through Dr. Pincus, my transplant doctor. My bone marrow transplant coordinator is the one that initially reached out to Dr. Silber, and that's how it started, the process.
And Jennifer was our first case in 1997, and actually we have the only successful cases in the United States, and that's only really because insurance doesn't pay for it. ASRM calls it experimental, which it certainly is not. So all the other centers are, for whatever reason, trying to freeze embryos or eggs. But you see, it can't happen because when you're on that initial chemo, you could try to stimulate you for IVF, and it's not going to work because the developing follicles have all been killed.
Fascinating. And is there any specific advice you would give to those recently diagnosed, those patients recently diagnosed that are not necessarily keeping things top of mind, that maybe 10 years down the road, 15 years down the road, will want to have children? What would you say to that audience?
I think one of the things that I've always advised is, while you may not think you want children, even, no matter your age, it's always important to just go and ask the doctor about everything. Not just about the cancer now, but how is this going to affect me later? A month. And you just keep building, so you have this idea of what can I expect? What should I be looking for as I, get through this stage? There's another stage that I'm going to face once I get past this initial dark period, and that's what you are able to hopefully focus on as well. Give you that hope that the
quality of life
yes.
that you're looking for, right?
Thank you.
Yeah, absolutely. No, it's understandable. And can you talk a little bit about the actual procedures and how you felt around the procedures and just your experience once you found Dr. Silber and you had made that decision? What was that procedure like for you?
Well, there are two procedures you should talk about. One was the ovary freeze, but the other was the transplant.
So the ovary freeze was July of '97, and they went in. Oh my gosh, what's that
The
called?
laparoscope.
Yes, thank you. Laparoscopically, had a brain freeze, and it was. I mean, it was relatively painless. He went in through the belly button, and they had 2 little incisions in the lower abdomen. That was for the cameras, I believe. Is that correct?
Yeah. Mm-hmm.
And we're able to extract the right ovary without any trouble, and then from there you sliced it and froze it.
Yeah, you were back in the recovery
Yeah.
room, getting ready, to go home, and but we were then in the lab, just so to speak, slicing it, just peeling off that outer cortex and freezing it.
Yeah. I know that I had some bloating afterwards because they fill your belly with gas, but the recovery time was minimal at best for the extraction. And in October of 2013 is when we did the transplant back.
So that, okay. How soon after we took out the ovary were you able to start your bone marrow transplant?
The bone marrow transplant followed that September. So what, 3 months?
Oh, okay. So.
So July, August, September.
Okay.
Yeah.
Okay. And then talk about your ovary transplant.
So ovary transplant was exciting. So like I said, it was 3 months prior to my husband and I getting married, and we had decided that we wanted the ovary in and hopefully working soon after we had been married. That was pretty easy as well. Dr. Silber came in and oh my gosh, I don't even remember. Did you even slice me?
Yeah. Well, we made a delicate incision.
So delicate.
And used the microscope. Yeah.
Yeah. And that, I was out of work for 2 weeks, just as more of a precautionary. By the end of the first week, it was on a Monday, if I'm not mistaken. And by the Friday of that week, I really was feeling pretty well, but we took the second week off just for precautionary measures, just to make sure that everything was sealed.
And how long did it take for you to get your first menstrual period after that?
It was that March. Okay. So you said 4 to 5 months, I believe.
So you were right on schedule, really. Yeah. Because it takes that long for these resting follicles to develop to the ovulatory phase where they're hormonally sensitive. So that was right on schedule.
Yeah, because when you only took 3 slivers, you sliced it into 6, I believe you said.
Yeah.
So when we did this transplant in October, you scoured the left ovary of all the dead
We
eggs,
took out the dead tissue, right.
and then you transplanted 3 slivers. That's all we needed.
Right.
And the blood flow is what you said would rejuvenate and get it going, and it took about 5 months for me.
Dr. Silber, this question's for you. Jennifer from California wanted to know if this was a common practice in other facilities, other medical facilities.
Well, I'm glad Jennifer, the other Jennifer in California, is asking, is this a common practice? Well, I've said really openly, it's just outrageous that it is not, because it's a very robust procedure. I mean, we have over 75% pregnancy rate with live babies, healthy babies. There have been over 100 babies in the world, and it is practiced in Germany and France and Belgium, in Italy and Australia, in Israel, and in multiple centers. In Denmark, very big, but in the United States, nobody is doing it except us. And I think it's just related to the negativity of the ASRM which is stupid. A bunch of old guys that really don't want to look at the future, and are negative. And it's related to the fact that insurance companies balk at paying for it. And frankly, we've done these cases with no charge because we don't want cancer patients to have to be impeded from making a quick decision that will affect their entire lives just because of some kind of financial consideration. So frankly, we're the only place in the United States. I'm not bragging about it. I think it's a travesty, but we're the only place that does it.
A follow-up question to that, if they've already started treatment, does that mean it's too late?
That's a good question. What if they've already started their cancer treatment? Does that mean it's too late? Absolutely not. Jennifer had already started her cancer treatment. In fact, that's the ideal time, as Dr. Pincus told us 20 years ago, that is the ideal time to take out the ovary and freeze it, is after they've already started treatment. There won't be any live cancer cells in the ovarian cortex that way. So, yeah, I mean, even if you're in menopause from your treatment, no problem. Freeze the ovary and the resting follicles will be fine.
And then Beth would like to know, is there a certain amount of time after the cancer has been cured that you should wait to have the transplant?
Well, the question is, how long do we wait after the cancer has been cured to have the transplant? Well, first place, there's no rush, because you have a young ovary that's not going to age, and the eggs aren't going to be getting any older. They're just frozen in time. And so there is no rush. But we generally wait until the oncologist tells us it's okay and the patient's cured. And whenever the oncologist feels that the patient is cured, then we go by that. And that could be, in Jennifer's case, it was like 17 years because it was leukemia. But in most of the cancers now, with all the experience around the world, it can be as little as 2 or 3 years. So, I guess there are many questions that might be asked.
Yeah, there are a few other questions that don't pertain specifically to cancer and fertility after cancer treatment. Do you want to field some of those questions?
Well, yeah. The first, as we talked about a little bit earlier, if Jennifer did not have cancer and she just waited to, she wouldn't have, but if she just waited to 40 or 41 years of age, as so many modern women are doing for various reasons, to decide to have children, the odds are overwhelming she would have been infertile, and with a 41-year-old ovary. So it's a good idea if you're 24 and you think you're not going to want to have children until you're 40. Well, if you don't have cancer, well, maybe freeze your eggs. It's non-surgical. But you could also freeze one of the ovaries, and it won't hurt your fertility currently, or it won't have any negative effect on you currently. But then you'll have a 24-year-old ovary 20 years later that you can use to get pregnant after you've after you've accomplished your career and you've been a CEO and now you're ready to have children. So it's a good idea to preserve your fertility if you're in the modern woman's dilemma where you think you're not going to meet the right guy until you're older or really be ready to have kids until you're older.
Great. We do have a couple questions related to both no sperm in their partner and a vasectomy that had happened many years ago. So the first question is, what if their partner has been diagnosed with no sperm, or there's been no sperm found? What do you suggest for fertility options after that?
Okay, so if there's no sperm, particularly if it's after a vasectomy, with delicate microsurgery, we can bypass the blockage, and most likely 95% of the time have a good sperm count and they can get pregnant naturally. But it is a delicate operation, and it's usually not just a matter of putting the two ends of the vas together. It's usually a matter of bypassing damage to delicate tubules closer to the testicle called the epididymis. So it's not a small operation. But we inject a long-acting local anesthetic and there shouldn't be any pain. It's just a big procedure, but it shouldn't be any pain. But often the couple doesn't want to do that. So we can just retrieve the sperm, under local anesthesia in fact, and inject the sperm into the wife's eggs. Now this is under 200 or 400x magnification, but we literally pick up we developed this procedure originally back in 1992. And you can literally pick up the sperm. Now, you do have to break the tail, because otherwise it'll wiggle around inside the egg and kill the egg. So we break the tail, and then we take the immobilized sperm and inject it into the egg, and it's just normal fertilization. So now, what if it's not a vasectomy? What if the male partner just has no sperm, and it's not blockage, and it looks like he's making no sperm? Well, we discovered that in 60% of the cases, he is making a tiny amount of sperm, very tiny, not enough to spill over into the ejaculate, and so it looks like he's making no sperm. In fact, you could even have a diagnostic testicle biopsy that shows no sperm being made. But 60% of the time, there are a few sperm, and we can use those few sperm, again, with ICSI, we call it, to inject into the wife's eggs, and again, it's a normal pregnancy rate and normal fertilization rate. And now, I must confess that in those cases, 40% of the time, there really is no sperm, but 60% of the time there is, and so having no sperm production is not really a problem.
We had another question in. Jennifer, you mentioned that it was a few years that you had waited from the transplant to the time that you got pregnant. Is that correct?
Yes.
And so for both of you, Jennifer and Dr. Silber, what amount of time is a right amount of time to wait or seek alternative treatments?
Well, since Jennifer was really had a 24-year-old ovary, it was just fine to wait. But if a 35-year-old woman is not pregnant after a year, I think you really need to proceed quickly, because those eggs are getting old. Now, Jennifer, you still have some extra 24-year-old
Yes, I do.
tissue. So if you ever run out of this, or let's say your transplanted ovary kind of gets old, maybe you're 50 and it's becoming an older ovary, we can still give you back a 24-year-old ovary. In fact, you never have to go through menopause, because you have enough ovarian tissue to really last you till you're 100. And so this is pretty amazing. But if it's not a case like Jennifer's, we normally would recommend no more than 1 year of waiting.
Great. We did have one more follow-up question on the vasectomy. If there has already been an attempted vasectomy reversal, would you still give the same advice? The sperm retrieval, does that still apply?
Yeah, I would give the same advice. First place, vasectomy does not have any negative effect on sperm production. I know a lot of doctors mistakenly say if the vasectomy has been performed a long time ago, then that hurts the sperm production and you're not making sperm anymore, or they'll talk about antibodies, and all that is baloney. The vasectomy has absolutely no negative impact on spermatogenesis or sperm production. So we can always retrieve sperm and do IVF ICSI. But frankly, if they want, and the wife is averse to doing IVF, we can just do a better operation and cut out the old scar and just they call some of the vasectomy reversals, some of my patients call them reversal rehearsals, because I didn't make that up. The patients gave me that term, because I mean they really didn't go to where the blockage was, and the delicate duct were closer to the testicle. So it's just a matter of bypassing that.
So in some cases, the initial vasectomy reversal attempt didn't address the true issue or the true blockage or prevention of the sperm.
That's right. Most vasectomy reversals performed are just what they call vasovasostomy. So the doctor puts the two ends of the vas together and he figures, okay, that's it. And yet, in 85% of the cases, there is a secondary blockage caused by the pressure buildup after vasectomy that's closer to the testicle, and so they're not really bypassing the second source of the blockage. Great. I want to say one other thing. If a man isn't making sperm, or the wife has no eggs, there's something in the future, which is very successful in mice, and we're going to be starting to do this in humans soon. We're all set to do this, not to transfer the embryos from that, but to study it. But you can take skin cells from a skin biopsy, like of a mouse, and I'm sure it'll be true of a human, and you convert them to what we call iPS cells. induced pluripotential cells, which are really stem cells. They didn't come from an embryo. There's no ethical dilemma involved. We could just make true stem cells from somatic cells, from skin cells. Then, by incubating in the proper genes, we can get those stem cells to differentiate into eggs, good quality eggs, and then those eggs, in mouse at least, can be used in IVF and make normal babies, and those babies grow up to be fertile and they have normal babies. So I'm predicting, based on all this work, and this isn't just science fiction, this is real, in 10 years we'll be doing this in humans where there are no eggs. And where there are no sperm, we'll be making sperm too.
Incredible. So one question from the audience. For those that can't wait the 8 to 10 years where this will be happening, what should they expect from their initial IVF process? In other words, when they're first going in to seek consultation and determine what the right fertility path is, what should they expect?
Well, it becomes, what should they expect when they first go in for their first infertility consultation? Well, there's a variety of myths that are frankly revenue generating, like many tests, laparoscopy, which by and large is only needed in a tiny fraction of cases, all kinds of hormone evaluations and tests. The most important thing that we can go by, really, the age of the patient, if there is any sperm or not in the husband, and finally the ultrasound, but done properly, so that we actually count the eggs, count the antral follicles, and we can predict what her ovarian reserve is. So those three things are really all that's necessary, and it's not very costly. But one could, instead of spending a few $100s on those tests, you could wind up spending $20,000 on sperm DNA fragmentation tests, sperm antibody tests, on anti-globulin tests in the wife, by lots of hormonal assays. You can go through multiple cycles of IUI that have a very low success rate. So there's a lot of possible things. I think the modern view, though, is that particularly if the woman is past 34, you should go right to IVF as soon as possible and not mess with all this other stuff.
Great. And Jennifer, they'd like to know what you will tell your children about this process.
I will tell them everything. It's been an adventure, to say the least. And it's something that I know I'm very proud of, being able to have this story to tell. But the baby was conceived naturally, and at the time, what Dr. Silber was able to provide was a pure miracle for us, and it's given us a family for sure. So, I don't think my husband and I will have any problems whatsoever because it's our story.
Yeah, this is natural pregnancy. I mean, this wouldn't disturb anybody who's worried about and feels uncomfortable with IVF, because it's just a totally natural process. Now, when we first started doing ovary transplants, there was initial criticism, is this ethical? That was a long time ago, over 20 years ago. But sometimes ethics is confused by journalists and others. It's ethical if it's not harmful to the patient and it's not harmful to society. But sometimes it's considered unethical if it's just a bold new idea. And this was just a bold new idea, so we were criticized for a few years. And I remember my colleague originally in this, who did the first experiments in the sheep, Roger Gosden, good colleague, in 1994, he said, there's nothing that will dispel criticism like a raging success. And that's what we've had.
Well, Jennifer, Dr. Silber, thank you both for being trailblazers. Jennifer, congratulations. Thank you so much.
Thank you.
Thank you. Okay, so if you have any questions, just you can go to our website at infertile.com or just call the office. We'll be glad to answer any questions.
Thank you.